I'm Carolyn Yarina. I'm the CEO and co-founder of CSU Global Health, and we are a medical device company for emerging markets. Well, the reason we chose Africa as a company is because of the great opportunities that are there. And it's really one thing that we've struggled with in the US is reshaping that paradigm and that story. When you think of Africa, you might think of the safari or tribal huts or villages, and that's really not the Africa that we've seen. We've seen growing metropolises and middle class that have been searching for better healthcare. We've seen hospitals that are just building out infrastructure that's really impressive and are looking for new technologies and better ways to spend the money they're already spending on healthcare. And Africa is a great launching point because their medical device markets are growing at over 13% a year, much more than Western countries like the United States. And as we grow and we look at where those opportunities are, we don't start where it's easy because people are already there. We start where these pathways and the fragmentation provides a lot of opportunity for us to grow as a company and be that channel, that pipeline for medical devices into emerging markets. The problem that we're first targeting with our medical device company is access to blood. And our first device works in the idea that your own blood is better than someone else's. And if you think about that a little bit further, is when can you actually use your own blood? And that's when there's been a trauma that's caused you to have internal bleeding. So that's good blood that's pooled, essentially leaking your plumbing, that's caused that blood to pool internally. And we've created a device that can allow you to very simply and mechanically suction that blood out through a filter and transfer it directly to a blood bag to be retransfused. And this is a process, autotransfusion. It's in and of itself is not new. Johns Hopkins University has been publishing papers on how using your own blood is better than someone else's. And that's because as blood sits on the shelf, it loses its ability to transport oxygen and nutrients. When you get someone else's blood, it depresses your immune system and makes you more susceptible to hospital-based infections. And you don't know what diseases may be in that blood if it's not been properly tested. So we've developed a device that really focuses on trauma. So traffic accidents, bullet wounds, first trimester pregnancy complication, anything that's causing this blood to be pooling internally, and our device can salvage, recycle that. And we do this all at a cost that is equal to 1 unit of donor blood, which means in the average trauma surgery, we're still saving the patient money at the same time as providing them access to a resource that's not always available. And that's blood. You need blood, whether it's in a large hospital, a combat zone setting, and we're working everywhere in between. As a medical device company for emerging markets, we're tackling the $64 billion market that exists in emerging markets. Not only that, it's growing at up to 5 times the rate of Western markets like the United States. Right now, $3 billion is spent on blood each year, and we expect the market for autotransfusion and our device is $600 million in Africa. As we're targeting getting our product to market, as a medical device, there are hurdles that we go through. One is the safety and development of the product itself and making sure that we've followed those steps and processes to get it to market. Now in the US, we'd be following the guidelines of the FDA, of ISO standards are the 2 main areas. In emerging markets, we do follow those same requirements, but the regulatory standards themselves are not always the same. So when we work in Ghana, we are working with the local regulatory body that's there. They have their own Food and Drug Authority and that we need to get approval from in order to start selling in Ghana. And this regulatory system varies from country to country across sub-Saharan Africa. In Ghana, there is this regulatory body. Some countries do not have regulatory standards for medical devices in particular, which means that we theoretically could start selling now, even without regulatory approval. But as a medical device company, we have high ethical standards. And so we need to make sure that those products are safe and tested before they're used. And so we follow local regulatory body in a well-respected country, and then we use the international regulatory body like the FDA, or more likely for us, the CE mark, the European equivalent, to allow us to scale across multiple nations.